All right, I should be unmuted. Can you hear me?
Great.
Great. First of all, I just want to say we're very honored to have Catalina and Anka on the phone with us. How you guys? SVP has partnered with Building One Community for the past 3 years, and it's been as the organization has refined its mission to promote immigrant integration in the Stamford community. B1C's programming, which is free, includes English literacy, jobs training, citizenship and legal services, and parent action groups that are designed to empower parents to educate, employ, parent action groups that help their children in schools. The overall objective is to help educate, employ, empower, and engage immigrants with the broader community. Just to provide some context to Building One Community's work, it's very interesting to note that over 2.1 billion in total net business income is generated by the immigrant businesses in the state of Connecticut. 46% of children in Stamford public schools speak a first language other than English. And then 37% of Stamford residents are born outside of the United States. These are all sort of astounding figures when you really pause to think about that. A further note is that the CARES Act excludes the estimated 11 million undocumented immigrants in our country, even though nearly all are working and paying taxes. This population is concentrated in low-wage sectors that have been the hardest hit by the pandemic, and they do not qualify for federal benefits. As a result, with COVID-19, B1C has shifted its work to fill gaps in food, healthcare, and education for their immigrant program participants. They've also launched a virtual fundraising campaign to support these efforts. We will hear more about their challenges and endeavors, but first, just to introduce our speakers, Catalina Horak, founder and outgoing executive director of Building One Community, and Anka Badurina, formerly the Senior Director of Programs and soon to be new incoming Executive Director of B1C. As co-founder and leader of Building One Community, Catalina has been instrumental in driving the growth of the organization, which has successfully served more than 10,000 immigrants from over 100 countries. Over the past decade, she has been the driver behind Building One Community becoming a thriving center for the immigrant community. She's played a pivotal role in guiding Building One Community from startup to an established and impactful organization in the state of Connecticut with a voice at the public policy table. Anka joined B1C in 2015, leading its research into employment trends, creating its workforce development program, and engaging key funders and partners to support its expansion. She has played an integral role in shaping the programmatic agenda and priorities for B1C, including providing research, data analysis, and counsel on critical issues impacting the civic and economic integration of immigrants in a city where nearly 2 in 5 are foreign born. Dr. Badurina has a PhD in cultural anthropology, a master's degree in commerce, and an undergraduate degree in modern languages with a major in business. She taught integrated marketing communications, brand promotion, and advertising as an adjunct professor at the Tecnológico de Monterrey Business School. She served as Chief Telecommunications Officer for the Ministry of Security and Safety in the Querétaro state government in Mexico. Dr. Badurina is multilingual and understands diverse cultures, having lived in Venezuela, Mexico, the US, Canada, Japan, Spain, and the UK. So we are very, very lucky to be partnering with them and with Building One Community. And I'd like to go ahead and just begin by asking some initial questions. So tell us about the work, and I guess this would be maybe perhaps for Catalina, tell us about the work of building one community and how the current crisis has impacted the program participants, and how is this changing your focus?
Sure. Thank you, Susan, Christine, and SVP for all the work that you have done with us over the last 3 years. You've been amazing thought partners, and this is the time where we need thought partners more than ever when we're just, dealing with so many challenges, and your support has meant the world to us. So as Susan said, our programs span 4 critical areas, what we call the 4 E's, the educate, empower, employ, and engage. Research shows that are absolutely essential to helping immigrants thrive and fully integrate into their new communities. We serve low-income immigrants who are part of what we call an invisible economy. They work in essential fields like childcare, healthcare, housekeeping, landscaping, food industry. Many have jobs that pay in cash, or they live with a family member who is not documented. The vast majority of the people that we work with live in what we call mixed status homes. So some members of the family are documented, some members of the family are undocumented. These are all factors, as Susan mentioned, that preclude them from receiving any money from the federal stimulus payments. For all of them, including those who are still employed, the cost of food, cleaning supplies, and rent, they are really at a breaking point. We have adjusted our programming to online service delivery due to this pandemic. So every single program that we have has now an online delivery component. And at the same time, we have shifted and started what we call an emergency fund to support people with those basic needs. So if you come to our center right now, you will see what used to be classroom spaces and teaching spaces converted into a kind of food pantry that we have. I think what is really important to understand kind of the play that we're rolling also at the policy making level is sort of like what we call the key elements of what is it that our work is so important and what has resonated. And in less than 9 years, we have established our organization as a go-to place for the city and, lately also the state to reach out to us and validate some of their thoughts and help them at the policy making level. So, we spend a lot of time understanding the needs of the community, developing trust and connections with them, having a very holistic approach. So for us, going deeper is better. It's what defines us, not going wider, and including all the needs, like economic needs, literacy needs, but also social needs. So that we have this community center model where we work with other organizations. We pretty much work with every single nonprofit organization in the Stamford area because they are working with the same population, and our model is not to reinvent the wheel, but to work in partnerships and complement each other. And we are also kind of modeling integration inside our center, right? So the current crisis has, like I said before, made us pivot into a whole building on the understanding that we have of this population, the trust, and asking them, they started coming to us asking for help and guidance, sharing their fears and challenges. And 3 weeks ago, we launched the emergency fund that we have helped. We're helping over 25 families a day, right now. The most important thing, I think, is that we have a two-way communication with our vulnerable families. So some of them, the most vulnerable families, are so overwhelmed by the situation that they're not even reaching out to us. We're having our case managers from home reaching out to them and understanding their needs. The lack of jobs, the fear of not being able to pay the rent, not having a primary care doctor, not having the tools to help their kids at school, the fear of saying no to an employer. So some of them have COVID-19 symptoms and they're worried about expressing that to their employers. All that help us build that emergency response fund and shifting the new and existing programs to the online platform.
Can you talk a little bit about what those immediate needs actually have been and how you see that evolving as we've gotten deeper into this pandemic? I don't know if you can hear me.
Yeah, sorry, I'm muting myself. Thank you again for inviting us. I will take that one. And as Catalina said, we pivoted to a different kind of service provider, quote unquote, from what our way of operating has always been. And the first thing that we did was reaching out to a number of families and interviewing them to really understand what the needs were. And this was nearly 5 weeks ago, 4 or 5 weeks ago. And throughout those interviews, we learned what many of us in other organizations has become very clear, is that the need to put food on the table is clear for everyone. The fear of not being able to work and get that food for their children. The fear of not being able to pay rent and get evicted and all the things that come with it. And paying utilities and so on. And utilities is important because of the new distance learning system that we have in place. So what it's become very clear, this, as you mentioned at the beginning, Susan, is that there is a lack of safety net benefits for this population in particular that doesn't allow to shelter in place, and as you or myself are doing right now. Right, so most of them can't really do it, and if they do it, it means that they lose their jobs, right? And then they struggle to feed their children, pay the rent, and cover the bills, as I was discussing. The other thing that it became very clear is that there is a need for information about prevention, and that information needs to be very concise. There are layers and different groups within the immigrant communities, not as monolithic as we would like to think. Some people will need more visuals and very clear bicultural, bilingual messages that will resonate with them and will make sense to these communities. And it's also important not only what you say, but who is the messenger of this kind of information. Right? Who provides it? It has to be someone that they trust and these kind of figures. The other important piece is I think at the stage we're right now, it's not only about prevention, but it's also about treatment, right? Where they can actually access this treatment, because for most of them, insurance is not available, right? They lack insurance. They lack a primary care doctor, and they lack the ability to isolate. So what is information out there that when it comes to treatment that they can have access to? And again, that information is important that it's in multiple languages, not only in English, and that it's very clear and concise as well. And the other issue that we learned also through that survey and interviews is the distance learning issues, right? We have, many of us are dealing with kids at home trying to go into this new system of online learning. As challenges as that can be for many of us, for them it has a new dimension, right? Many of them do not have computers at home. Some of them have been able to secure computers through the school. Some of them have borrowed, but then there is the issue of connectivity, right? Some of them lack internet, and the school is providing some hotspots, but for some of them that they do have internet at home that they are paying, that might be running out sooner rather than later, right? And if they have computers and they have internet, then there is the issue of how it's a whole digital divide, right? How can they actually access and know how to use these computers and help their kids with the technology part, but also there is a component of how do I actually help my kids with this new system, with these new instructions and so on. So there are a lot of issues right there for the low-income children when it comes to the digital device as well. And again, I think we have learned that the system, quote unquote, does not understand them as well as they could or should. They develop policies and implement strategies that have them in mind, but don't include the voices of them when they are developed. So as a sense like that, those are solutions that are crafted without hearing their voice and including them as parts of the planning process.
Maybe perhaps to that point, can you speak to how your relationship with the city of Stamford has evolved, as well as other partnerships in the city of Stamford?
So I can take that. So I think that one of the things that we did from day one, as we started the organization, was understand the importance of building relationships. So we dedicated a lot of time and effort over the last 9 years to have very strong relationship with policymakers, from Senator Blumenthal's office to the mayor's office, to Jim Himes' office, to the Stamford Public Schools. They're okay with the superintendent who's on our board. That has paid a lot of dividends right now because they have been reaching out to us almost daily on asking us for our input and feedback on how to deal with this. What Anka didn't mention is that she has been on a task force with Stamford Health, with the Stamford Hospital and the city, because the numbers, as we have seen across the country, of Black and brown people across the country are, significantly higher, and that's something that really worries the city. So the city has really listened to us. We have been at the table from day one, trying to guide the city's response and anticipating the needs of this incredibly highly vulnerable population. So 5 weeks ago, we said to them, when we were not even thinking, before the schools were suspended, the schools were closed, Anka and I were on calls with the Department of Social Services and saying to them, people need a primary care doctor. The majority of the people that we work with don't have a primary care doctor. So if they have symptoms, what are we going to tell them? And it took us 2 weeks of pounding on the table saying, this is going to happen, this is going to happen. And the city recognized that and put a structure in place for people without primary care insurance, a bilingual person who we can funnel all the calls through her, and then people who have symptoms and are uninsured and they don't have a primary care doctor are eligible to be tested. Another thing that we kept saying to them is you can put the most wonderful newsletter on COVID-19 response on your website, but if it's not bilingual and it's not simple, is not going to reach the population that you think you're trying to reach. So that has been really, really important. Just a few minutes before I got on this call, Ted Jankowski, the Director of Public Safety, called me and he said, are there any other trends that you're seeing? And one thing that we have seen in the last 5 days, it's a lot of a very high volume of people of Hispanic origin who work in grocery stores, who have tested positive. And then the city doesn't have a way to know that, because when people are tested, they're not, they don't give any information about where they live, and they don't give information about where they work. So we actually have a conference called at 11:30 to talk about that with the Director of Economic Development, with the police chief, with the Director of Public Safety, to craft a new policy and outreach on how to reach the population that they are working with. So I think that, and the other thing that I think has been really important for us, but it's not only our relationship with the city and how we're doing this, but also being the voice of the immigrant community, making sure, as Anka said, that policies are based on reality and not on their perception of reality. And the city has been really good about being open to that when they have kind of tested ideas with us, and we said, we don't think that's going to work. They said, okay, what would work? Let us know. So we've done that. And the other thing that has been incredibly important is the relationships that we have with other nonprofits. And again, something that we invested a lot of time and effort into before, and then collectively we are having that voice with the city that is helping us strategize as a community and doing the outreach and the connection at the ground level that the city cannot do alone.
Yeah, it's incredible. You know, and a further thought comes to mind that shows the reality of the situation, which is the order to shelter in place. And many of your program participants are crowded in a 1 or 2 bedroom apartment up to 10 people, you know, and so the concept of sheltering in place, there's no other solution there. And so I know you've helped them think through.
And we've worked with the city on that. I mean, way before the numbers started spiking up, you know, for the immigrant community. And when we thought that this was something that was going to be a little bit distant and it was not applicable to our community, you know, again, Anka and I were with the Department of Social Services and saying, you cannot tell people to isolate when they live in high density housing. It's just, it doesn't work like that. You know, what is your plan? And they kept saying, oh, we're working on it. We're working on it. You know, then we were on calls with Jim Himes and then, you know, with the city. And it seems like, you know, finally by next week, by next Monday, they're going to have the Yukon dorms as a place for people who cannot isolate at home, you know, to be able to go either when they have tested positive or when they have symptoms that are very likely to be positive, and before they start spreading the, you know, the virus to their old family members. Because we're seeing, I mean, the other thing that we suggested to the city, and apparently they're working on that, and it is do heat maps and just map the neighborhoods, map the places where people who are being tested are positive, and see what kind of targeted outreach we can do together with the city so that we can avoid the spread of the virus.
Shifting to the policy level, can you speak to how your work is now extending to the state of Connecticut?
Okay, I'll take that one and then you know, the rest. So Mark Ardosh from SVP was the person who connected us with the state. And to our surprise and delight, Mark, when we joined that conference call a couple of days ago, so many people at the state level in Hartford had heard about us and were very eager to have our voice there. So we are now part of this task force trying to see that the state has put together in helping to bring attention to the specific issues of the undocumented. It's very interesting to see what happened last night in California, and it's kind of like the role of philanthropy, the role of the business sector, and the role of, you know, the state governments, recognizing the enormous contributions of the immigrant community and the lack of support that they're receiving. So we are watching very carefully what California is doing. And I have a conference call with you, Susan and Christine, tomorrow with the state, at the state level to have that. And I have to give them a lot of credit for understanding that they need to work with people who are having this experience on the ground to craft policies, because I think as a system in general, as Anka said, we're very good about having highly educated people at the policy level, at school levels, decide what people need, and without asking them, and then, you know, we put up so much time, effort, and money into systems that don't work with best of intentions. So we're very hopeful about this statewide initiative to understand the needs and to also learn from each other. I think that one of the things that we have not done well, even in Fairfield County, is that, you know, we kind of work really well with the Stamford community, but even what's happening in Norwalk and what's happening in Bridgeport is, you know, we're in silos, and, you know, the lack of county government in Fairfield County is, you know, there's no like county official that understands that. You know, Jim Himes is the only one in his office, sort of like the person who has the most holistic view about the county. And I'm hoping that post-COVID-19, we will understand the importance of learning from each other, not only within the city, but also at the county level and at the state level.
So do you see advocacy as playing a role in sort of knitting together that broader view? Are there specific advocacy strategies that you would believe would be important going forward to change policy?
I can take that one, and I would say yes, definitely so. We can see that this COVID-19 has brought into sharp focus the unique challenges that the immigrant community face in the whole country, but certainly in our area as well. And two kind of things come to mind is the intersection between immigration and the public health policy that we have in place right now, that it's not matching quite well, right? We know that there is the exclusion of our community from medical benefits. You know, the bill excludes even people with green card holders, right, from having this kind of medical benefits. And it also excludes a large section of the immigrants from the aid package, as you mentioned at the beginning, Susan, right? We have 4 million immigrants in the United States, typically undocumented, who pay taxes not through the Social Security number, but they do so through the tax ID, the tax identification number, which is usually called the ITIN number, and they are not receiving any benefit back, right? So what can we do with these kind of issues going on that at the policy level are not considering the immigrant community, particularly the undocumented? So what can we do to advocate for them? And in the end, it all comes down to this need for a comprehensive immigration reform, right? And that's where we've been always bringing it to the table, that there is a need there. And in the end, I think it all comes down to that. At the local level, I think our board, for example, has been very vocal. They have written a letter to the local officials, but also want to escalate it all the way up to the state officials, trying to advocate for the things that we are doing on the ground, right? To advocate for this kind of information to multicultural, for securing that this testing is actually free of charge to the community, and so on and so forth, all the things that we've been talking about today. So there is a key role for advocacy to be played right now. And I think this pandemic is opening kind of like the window on the door for everyone to really do something now. And if we don't do it, we're gonna miss it. And I think we're gonna do a disservice to the community that we serve. So it is, I think, the moment to start working towards that now. Otherwise, we're going to miss the train and we're going to regret it post-COVID-19.
If there's ever been a time, this pandemic has proven we're all truly one community of people. We're all affected by this disease and we're all interdependent. So it's never been more apparent. So we support you in that work. Is there any further comment you would make about the role of philanthropy in this effort?
You know, what we know from the recent research from the Philanthropic Initiative for Racial Equity, actually, or Equality, that is called, we know that only about 8 to 9% of grant making from foundation actually goes to communities of color. So there is, I think, an easy case to make here that philanthropic capital could be more inclusive to those communities as a general case again. And the other thing is that the philanthropy can use that power to amplify the voices of the marginalized and Black and Brown communities that we've been talking about. And something that Catalina and myself have been talk about often enough because of our own experiences working in different countries, is that we see that solutions are going to come not only from the nonprofit sector and not only from the philanthropy sector, but it has to be solutions that to these complex problems actually need to bring more people to the table. So it's the philanthropy, it's the business sector, it's the public sector. So if we want to do something, how can philanthropy, with the power it holds, push for that convening of the different players on the table to really look for innovative solutions to these very, very complex problems?
Well said. Should we pause for a minute for questions?
Yeah, I was just looking. I don't have any questions in the chat box, so some of you may have seen it pop up. I just put a note saying, you know, enter here for questions. So if I'm not seeing it, I'll just pause a minute if anyone wants to type a question, and if not, we can move on and then we'll ask questions again in a little bit.
Hi, I have a question. May I ask? I'm on the phone.
Okay, can I ask who this is? Because we just see a phone number.
Yeah, of course, sure. Hi, it's Steve Saloom from Fairfield County's Community Foundation.
Okay, got it. All right.
Hi, Catalina and Anka. Glad to hear all this, and thank you, SVP, for doing this. Catalina, you were just mentioning the work in California. How can I do, is there a name of the group, or what's the best way for me to try to catch up with those developments? Do you have any sense of that?
Yeah, hi Steve. I'll be happy to send you the information, but it's all over the news today, the New York Times. It's a, you know, the governor of California announced that initiative last night, and it's, I think 40% of the fund will be philanthropic donations. And then the other 60%, from what I understand, will be the state of California. And it's basically, again, it's very preliminary, but it will be distributing cash almost sort of kind of the same way that people who have Social Security numbers, who have paid taxes, will be getting, you know, the $1,200 plus, you know, the X amount per child. That's what the state of California is trying to do. And that's part of what we discussed with the state of Connecticut in this task force, kind of understanding the needs and who is the population that needs the support, and what role can the philanthropic sector, and as Anka said, we believe that we should be pushing also for the business sector to contribute to this. So I think it's a work in progress, but you know, the only information that I have right now is what has been.
Oh no, that's fine. Thank you. Yeah, and I thought it might be valuable to follow too, just for the dynamics that led to this, right? And I'll try to keep track of how that's unfolding to see how we might be able to make those dynamics apply here in Connecticut as well, along with you all, of course. So thanks so much.
Thanks. And we do have another question. How are people getting food in particular? You know, is it through a food rescue, through, you know, if you guys can talk a little bit more about that.
I can take that one. There are a number of organizations out there trying to provide food pantry and food to the immigrant community and other communities alike. We at B1C have our own pantry, where it's becoming a reality. It's that not only for us, but for, you know, in our calls with P2P and other food assistance providers, it's becoming a reality that is more and more difficult to get items because of how affected has the supply chain been because of the COVID-19, right? So we at B1C are providing, P2P still comes once a week. We have our own food pantry. We also have the Stamford Public Schools offer what they usually do as a free and reduced lunch for the kids at the school. They are doing it in different sites. So we are one of the sites. They come 3 times a week to provide food for the week. And then we have Filling in the Blank, which is another organization that provides kids with food over the weekend, so they come to us. But what it's a reality is that again, the food supply has been compromised at the national level, and this is a major concern for many organizations trying to secure this food. We have to go to very creative routes to secure food, right? Going through catering companies that are providing meals to the hospital and trying to get some items through them, for example. So there is not a clear line right there.
Thanks. We have another question about giving maybe some practical examples of how you've partnered with other nonprofits.
Okay, I can take some of that, and maybe Anka can add a few things. So practical examples all the way from understanding the needs. So we have been sort of like a social destination place for the day workers. That's why we're open Saturdays and Sundays. They are a very vulnerable group of the immigrant population. So right now we have New Covenant House packing lunches. They used to, when they were not working, they used to go to New Covenant House, the soup kitchen, to get the lunches there. Now we have volunteers who pick up the lunches and the bag lunches. They bring them to B1C, and the day workers come. They know about 12:30 for their lunch every day. We have, the Stamford Public Schools, for instance. The superintendent reached out to us 2 days ago, and she said that there were a number of kids who have not had any contact with the schools since the schools closed. And they didn't know how to, connect with them. So we are talking again about heat maps, neighborhoods, what else to do to connect. Family centers in our case. This has been so traumatic for our own staff who are on the front lines getting these phone calls. I mean, phone calls take half an hour with each family because they have no one else to talk to. And, they usually break down and they cry and they're desperate. So we're very worried about their own mental health of our staff. So reach out to family centers because we don't have, mental health experts in our staff, and family centers has given us access to their own therapists so that they can support our own staff. The Vita Collaborative in Stamford, that group, the Stamford Hospital, we were able to secure face masks for our employees, but also for our families who are coming to pick up the lunch and asking, like, what else can, we're worried we don't have face masks, can you give us masks? So, the Stamford Police Department also, I'm going to be on a call with them in a few minutes, but it's also the lead outreach person from the Stamford Police Department reached out to us last week and said, we need to put a program together. And she was on the street with one of our outreach workers, talking to the day workers by Exit 8 and going to the marquetas, the corner stores together because, we all understand. So just lots of very practical, nitty-gritty examples of what it is. And all the way from, we are grantees of the Lone Pine Foundation. And that has given us a really good kind of point of reference, even from day one, things that we didn't even think about. We have a weekly phone call with Lone Pine and other grantees. And I think that that's something that, be really nice for SVP grantees. How can we learn from each other? 4 weeks ago, Bob Arnold from Family Center said, establish a code for donation, establish a code for expenses for COVID-19 so that you know right away. You don't have to go backtrack. We did it and now we can generate reports, for donors, for everything, for expenses, for the SBA loan, all of that we honestly, we would have not thought about. So, from administrative examples to very practical examples, partnerships and working with other people. And we go back to like what I said at the beginning, that we spend so much time building relationships. It wasn't just with the city or with elected officials, it was also with other nonprofits, and it has paid high dividends at this point.
Now that we see sort of discussion about flattening of the curve and we're starting to visualize a post-COVID-19 life at some point, can you speak to how you see that world for building one community? Before this all happened, we were working hard on English language learning programming and issues around integration. What part of this do you see informing your future work?
I'll take that one. We've been working particularly in the ELL program, as you mentioned, on trying to see how we can restructure the program and improve it. And this is a cycle that it has taken us quite a bit of time, because we are working and have a system and a model that provides ELL classes that are a bit unconventional compared to the other English language learning providers in the city, in the sense that we're not a semester-based organization, but it's a drop-in. So just to make sure that those people that are working on temporary jobs and I clean a house today, but I don't have a job tomorrow, can come in and have one class if that's all they can. So our model is providing support to this particular community that other models might not work, but it brings a lot of challenge into it. So we've been working on how to improve this system in general. And then COVID-19 happened. So that restructuring has kind of brought different layers. What we did right away is trying to understand how can we capitalize on so many volunteers. We rely heavily on volunteers who are really, really engaged with the community and the work they do, and capitalize on their time and on them being sheltered at home, and have them becoming tutors, if not teachers for the time being, but tutors to our learners. So we've been matching tutors, volunteers with our English language learners, and trying to really train them both how to use Zoom, for example. So now we have weekly lessons. We went right away into people that we knew were going to have their citizenship test, and because of the uncertainty of when that could happen, citizenship classes were also out there right away taking place, right? And we've been doing this, prioritizing who will take these classes, and we are growing week by week. But in a call we had this week with the volunteer manager and the ELL manager, thinking when we face in reality as normal, it's not going to happen. It's not going to be business as usual, and we're going to have again all the volunteers pouring into our doors, not even perhaps our program participants. So how that would look like. And I think in the future, even when normalcy, it is part of our day life, that line of business that is virtual, it's something that we may want to remain and be part of that restructuring of the ELL program, because it's proven that that there are a lot of people out there on tap that might not be willing to leave their home quite yet. You know, it might take quite a while, and yet they can still contribute and have these one-on-one sessions and so on. So that's part of what we're figuring out, that no matter, you know, in a year time, that might be part of what we still want to do, to tap into people that might not be able to make it to the center. Many of our volunteers are elderly and may want to still remain at home because they might feel fragile until we get the vaccine. So how can we keep on engaging the community in this kind of programming? So ELL is one example, but it's the same. We're now having our wage recovery program is taking place virtually as well. So can we have a combination of the model where once a week is actually happening at B1C, but another time a week is virtual for people that, you know, and we can have it in different hours. Same with ILS. Can we have a virtual consultations in the evenings or weekends? So we're trying to figure out how to capitalize in what's happening with the COVID, and see what opportunities might be out there that we don't want to miss once we can actually go back to the physical, quote unquote, world.
And I just want to add that, sort of like there's a practical component about post-COVID-19 and kind of the re-entry. And I think that that's something that is really important, that all of us as a sector think about what would re-entry look like, and what are the lessons learned, as Anka was saying, and things that can be applied to continue to work with at a different level. But it's also, I think there are great opportunities at the policy level. At one point we talk about sort of like, this was like an equalizer, like this was affecting people of all kinds of backgrounds. And at the end, like everything else, it affects the most vulnerable people in a very different way. And we can choose as a system what to do about it. Anka mentioned earlier, and this is something that really worries us, and we think that there's a humongous opportunity here, that we need to jump on it like right now. What are the schools going to look like in September for these kids who basically lost an entire year? If we were worried about the opportunity gap, if we were worried about kids underperforming before that, these kids have lost an entire year. It doesn't matter how many Chromebooks they have. If their parents cannot help them at home, if the parents don't speak fluent English, to be able to navigate technology and also the material, the content of what these kids are learning, what are we going to do? We're going to have to need to implement more after-school programs, a whole new level, and this is the time to think about it. This is the time to think about policies and Board of Educations, and now it's a difficult situation because I just read that City of Stamford, the Board of Reps are saying like we need to cut the budget of the Board of the Board of Education, the schools, because we're going to have less income. So it's a very complicated situation, but we need to think about post-COVID-19. We need to think about everything that is happening, and I think at the federal level, we have elections coming up. We have seen who is stocking the shelves, who is cleaning the bathrooms, during this pandemic. Many of them are undocumented, they're paying taxes. Let's think about the need to put our political capital into comprehensive immigration reform.
I guess I'll just ask one more question, and then unless I don't see any. Oh, I do see this note here about volunteering. Maybe just a general question with this SVP audience. How are there additional ways we can help? I mean, whether it be as simple as volunteering or to the extent of our engagement with you in the strategic work, are there any asks that you have of all of us on this call?
I'll take that one then. There are always volunteer opportunities for us. You don't need to be a Spanish speakers, but Spanish speakers are always welcome. And there are opportunities again for these homework tutoring sessions for our kids. Beside the ELL, we're running the usual homework club that we had in the physical space. Now it turns out into a virtual platform. So there's always need for more people that would like to help kids with their homework. But there are other practical things like we are doing delivery of food to families who are COVID positive and cannot get out. We learned about one of our parents, the educational equity program that we have. She's a single mom with 3 kids, and she's now homebound, and she lost her job last week. So we are doing our rounds to deliver food to these people, but any kind of, again, physical, whoever feels comfortable on doing these kind of rounds of delivering and leaving the food at their door is another practical example of volunteering as well.
And if anybody is interested from SVP, just please either send me or Susan an email. We can get you connected with Building One Community.
Yeah. And I think I want to go back to kind of the policy level, because so many of you are influencers and kind of you have the ability to kind of think at the granular level, like what can I do, if it's just to go to a grocery store and buy a few things and deliver them to somebody, or the homework help that Anka was talking about. But at the same time, we need to keep the eye on, you know, an eye on like what is coming, what we need to do. And I will urge, you know, SVP, as you engage with different partners on the importance of really having the voice of the community at the policy level. What are the role that nonprofits can play when it comes to advocacy and crafting policy? And what are the gaps that we're seeing and how to anticipate? And the other thing is, you know, you, Susan and Christine, have been absolutely fantastic with us on this area and Sky, but it's looking at models. What is happening outside of Connecticut? What is happening outside of Stamford? And look for best practices. We tend to kind of be very insular on the East Coast and Connecticut, and we think that we have reinvented everything and we're so good at it. And I think that that's something like, what are the best examples in other parts of the country, and how can we work across city boundaries to do that? I will, you know, encourage all of you as SVP partners, as an organization, to continue to think that way.
Thanks. So I want to thank, I know we're just about out of time. I'm glad to see we had such a big group today. I really want to thank Catalina and Anka and Susan for leading the discussion. And I think that what, you know, Catalina and Anka had to say gives us as SVP a lot to think about, especially as we make plans to figure out how we can impact systems change more in Connecticut, how we can think larger and broader about what we do. And stay tuned. Next week is going to be a session with Child First. And then as well, if you're interested, I think on the 30th will be a session with our partner, Pat Gentile, about Vita Tax, which is going to be a tax assistance program that they're trying to roll out for low-income individuals across the state. That's going to be at 11 o'clock as well. So I really thank everybody also for participating, and enjoy the rest of your day. Thank you again, Catalina and Anka.
Thank you, Catalina.
Thank you for having us.
Thank you for inviting
Thank you.
and for all you do. Yeah.
Thank
All right,
you.
we'll talk to you soon. I'm
Thank
going to
you.
stop the recording, everyone.